Hey y'all, welcome back to my channel. My name is Jeffrey. In this video, we're going to discuss your adrenergic drugs, okay? And obviously, with any type of drug, you're going to have your agonist as well as your antagonist, right? And within the agonist category, you're going to have several different categories. You're going to have your endogenous, you're going to have endogenous as well as direct. You're going to have your indirect as well as your mixed. Okay, so for your endogenous, there's actually going to be a mnemonic. There's going to be a mnemonic, and that mnemonic is end is during all phantom clones. Okay, and what this means is that you have your endogenous agonist. Endogenous, if I can spell, is going to be your END, okay? And this is going to be your epinephrine, your norepinephrine, and your dopamine, all right? And then for your other agonists, you're going to have your beta agonist, your general agonist, which is going to be your I, which is going to be your isoproterenol. Sorry, I can't pronounce that drug at all. You're going to have your beta 1 agonist, which is going to be your dobutamine, and then your beta 2 agonist, which is going to be your albuterol. Remember, that's for like asthma. You're going to have alpha 1, which is going to be your phenylephrine, phenylephrine, your alpha 2, which is going to be your clonidine. Okay? All right, now that we have that down, you're going to have your indirect as well as your mixed agonist. And there's a mnemonic for these two. So this one's going to be ants try calmly entering Peru. Okay? So it's going to be ATC is going to be for your indirect, and then for your mix, you're going to have your entering Peru. Okay, so your A is going to stand for amphetamines. Amphetamines. I don't know how to spell, but you know what I'm talking about. T is for tyramine, if I can spell it, it's going to be tyramine, okay? And then C is going to be for cocaine. Mixed is going to have your ephedrine as well as your pseudoephedrine, okay? For your antagonists, you're going to have a mnemonic for this as well. And the mnemonic is going to be one that I made, and it's going to be Venus, Venus, Prenus, Prenus, Ass, and Penis. Okay? It's going to be spelled a little bit differently, but there's a big reasoning for that. So for your alpha, it's going to span 2, and it's going to be your phenoxybenzamine. It's going to also include your phentolamine. For your alpha 1, you're going to have your prazosin, okay? And then for your beta general, you're going to have propanolol. For your beta 1, it's going to be atenolol. And then for your beta 2, it's going to be pendolol. All right? So these are going to be your different adrenergic drugs. All right, so here we actually have a list of all of the different drugs that we just talked about, as well as all of these different types of functions that they serve. So if we take a look at our direct acting agonist that we were looking at before, you're going to have your endogenous catecholamines, your beta agonist, beta 1, everything that we talked about before. Let's just walk through each and every one of these drugs. Epinephrine is going to treat your anaphylactic shock. It's going to treat acute asthma and even cardiac arrest. And the reason why you might think about this is endogenous catecholamines, these are going to stimulate both your alpha as well as your beta. So if you look at these are specific for beta or alpha receptors, and these endogenous catecholamines actually stimulate all of them. Okay, so for your norepinephrine, you're going to have your alpha 1, alpha 2, and beta 1. And remember, beta 1 is always for heart. Beta 1 heart. Maybe that'll help you remember. It's going to also increase your blood pressure. And there's also going to be that reflex bradycardia, which is going to actually decrease your blood pressure. Okay, or your heart rate. And then it can also lead to your peripheral vasoconstriction. Dopamine at low doses, it's only going to stimulate those dopamine receptors, which remember are going to be a part of that GS pathway. For your medium doses, it's going to stimulate those beta 1 receptors. Remember, those are in your heart. And in your high doses, it's going to be in those alpha 1 receptors as well. For your beta agonist, you're going to have isoproterenol, which is going to stimulate, and as a result, you could also have bradycardia, which we discussed before. And you can also have, this can also be used to be treated for heart block. Beta 1 agonist, albutamine, this is going to be for that type of drug that you would give for anybody with cardiogenic shock or acute heart failure. Beta 2 agonists, remember these are going to be for your lungs, so bronchodilation and especially for asthma. So anybody using an inhaler would be using albuterol. For your alpha 1 agonist, you're going to have phenylephrine, which is going to be a nasal decongestant. So you spray in your nose and hopefully it'll calm any of that decongestion. Okay. You can also have it in a eye drop form. So if you have one of these drops in your eyes, it's actually going to be mydriatic. Okay, and that's just going to dilate your pupils. All right. For your alpha 2 agonists, you have clonidine. You have it's going to be your presynaptic for your CNS, and it's going to be for alpha 2 activation. Remember, alpha 2 is going to be inhibitory, so this is going to decrease your sympathetic outflow as well as decrease your blood pressure, because remember, this is acting in opposite of what your sympathetic nervous system does, which is kind of increase heart rate, anything for that fight or flight response. So obviously this is going to be used in ADHD because if you think about inhibiting all of those thoughts racing or your heart beating really fast, this will help calm you down. Okay. For your indirect agonist, remember it's the ants try calmly. For your amphetamines, they're going to obviously increase your blood pressure, and um, it's going to help with that alpha agonist vasodilation, as well as your beta receptors on your heart, which is going to increase your uh, both your blood pressure as well as your heart rate. So remember, this can be used for ADHD or narcolepsy. Okay. Um, and then for your tyramines, it's going to actually, this is one of those things where if you have tyramines and you're taking MAO inhibitors, then uh, this is going to release a ton of norepinephrine and increase your blood pressure. Because if you're, say, drinking red wine or eating cheese, really aged cheese, those are going to actually be broken down by these these monoamine oxidases, right? So if you're taking MAO inhibitors, now you have this extra excess of these toxins that you need to get rid of, but you can't because you have tyramine in your system, and that's going to be competitively um, inhibiting that process. So you're going to have that increase in norepinephrine, increase in blood pressure. Cocaine is going to block that monoamine reuptake. So remember, when you have your norepinephrine, for example, you don't break it down. You literally just shuttle it back into the neuron or have it diffuse. So if you block the monoamine reuptake, you're going to have continuous stimulation with your endogenous catecholamines on your receptors, leading to an agonist effect, right? And then you have your mixed acting. So both of these, ephedrine and pseudoephedrine, are going to induce your norepinephrine release, and it's going to activate those adrenergic receptors only, okay? Ephedrine is going to increase your blood pressure as well as be used in spinal anesthesia, and pseudoephedrine is going to be used as a decongestant, much like that phenylephrine. Okay. And then for your antagonist, remember that mnemonic. I think it's pretty good. So your phenoxybenzamine is going to be irreversible, and it's going to be for pheochromocytoma, which is uh, the blockage of your adrenal medulla. So this is typically going to be used for hypertension prior to surgery. And phentolamine is going to have a very similar effect, except that it's going to be reversible. Okay, so this is going to be a reversible antagonist or inhibitor of your sympathetic nervous system. It's also going to be used during surgery. Um, for your prazosin, it's going to be that prototypical hypertension drug. It's going to act on those alpha-1 receptors. Okay, propranolol is actually going to be one of those drugs that is going to be used for myocardial infarction, glaucoma, atrial fibrillation, and hypertension as well. Okay, and that's going to be a general beta receptor antagonist. And for your beta 1, this is going to be specifically for your heart, and it's also for diabetic hypertension. So if somebody has diabetes and they also have hypertension, this is going to be the drug that you're going to prescribe for them. Um, yeah, so and then beta 2 is going to obviously once again be for your lungs, and but in this case is also going to decrease your cardiac reserve as well as your propensity for your bradycardia. So remember, your bradycardia is going to slow your heart rate. This is going to help. And then, so side effects of your antagonist, you can have bronchoconstriction, uh, uh, with your beta 2, so especially with your pendolol. Yeah, you can have hypoglycemia, which blocks those beta 2 receptors in your liver. It can mask tachycardia. And then, that's the reason why for patients with hypoglycemia, it's recommended for beta 1 blockers because tachycardia is one of those very important symptoms that you don't want to miss. And then you can have different other symptoms as well. So sedation, dizziness, lethargy, fatigue. All right. So I hope that this video has been helpful. Um, uh, but yeah, these are just some of my notes on adrenergic drugs. And I know some of you guys watch these videos and really want a way for me to consolidate them. So I hope that this has been helpful. Have a great day.